Now, speaking of second chances, I devoted all of last year's State of the State address to the disease that is killing more New Jerseyans than anything else every year, the disease of opioid addiction. Now, I'm not going to go over everything I shared with you last year, but first I want to say thank you. I challenged you last year to pass groundbreaking legislation immediately, and you did. But we're still losing too many of our citizens to this disease. But now, at least, we're taking concrete steps to try to turn back the tide of death and suffering. New Jersey now has the nation's strongest limit on opioid prescriptions. And since we implemented our new restrictions in March, just in March, those prescriptions have decreased by over 15% in New Jersey. It's working. We established state sharing in our prescription monitoring program in 2014. We were the first state to do it. We shared with our neighbors in Delaware. No one else was sharing this information at that time. Since then, due to the push from New Jersey, we have 15 more additional partners sharing information with us, including now all of our neighboring states, New York, Pennsylvania, Connecticut, and Delaware. So is the prescription monitoring program and its sharing working? Well, listen to the numbers. Back in 2015, we only had 198,000 cross-border requests into the system. In 2016, we had 1.1 million requests. And how about 2017? 3.5 million requests. With this tool, we can stop doctor shopping and pill mills across state borders, and we will save lives. In 2011, we instituted Project Medicine Drop to rid our medicine cabinets of these deadly pills. Since 2011, New Jersey was the first state to do this. Since 2011, we have collected 88 tons of pills at over 400 locations across our state, including now our corporate partner Walgreens in every store in New Jersey. We're getting these pills out of the hands of our children and disposing of them in an environmentally safe way. Attorney General Perino has instituted an online way for pharmacists and doctors and nurses and other citizens to report suspicious use or sale of opioids. And in addition, he has ended the toxic financial relationship between pharmaceutical companies and physicians, which can influence prescribing habits by placing strict regulatory limits on what pharmaceutical companies can pay doctors. It will stop this cycle, I guarantee you. That's not all. We've expanded the availability of Narcan statewide. We expanded Medicaid. We obtained a waiver from the federal government to open more treatment beds. We have connected patients with recovery coaches in every county in this state following their drug overdoses. We've converted a state prison to an inpatient drug treatment facility, and we've made drug court available in every corner of this state, all in the last 8 years. Through our Reach NJ program, we are lowering the stigma of addiction and connecting desperate families with the hope that comes from addiction treatment. Due to all of our work, I had the honor of chairing the President's Commission on combating drug addiction and the opioid crisis. My lead member of this bipartisan group is here today, and I now call him New Jersey's Patrick Kennedy because he was smart enough to marry a Jersey girl. Welcome home, Patrick Kennedy. Patrick and I, together with Professor Madras and Governor Cooper and Governor Baker and Attorney General Bondi, we presented 65 comprehensive recommendations to the President, and just last week, the White House announced that they have accepted each and every one of our 65 recommendations and are now moving towards implementation. And when they are implemented, we will have a real chance to stop the dying. Patrick, it could not have been done without our partnership, and our friendship going forward, I am convinced, will be based on making sure that people who are addicted and have mental health problems get the help they need and get it now. Because I don't want you to ever forget, ever forget. 175 people a day are dying in America every day. A 9/11 every 2.5 weeks. I am proud that we have planted New Jersey's flag on the side of hope and treatment and recovery. Believe me, I can tell you, we are truly leading the nation on this issue. I also want to thank an inspiration for all these efforts, and the star of our Reach NJ television ads, Ms. Vanessa Vitolo. She has been in recovery for over 3 years now from her heroin addiction, and she has become the beacon of hope for so many New Jersey families suffering with addiction. It is completely appropriate, as I look up in the gallery, that Vanessa is sitting with my cabinet, because she has practically been a member of the cabinet for the last year. I can't thank you enough, Vanessa, for your honesty, for your courage. It is an inspiration to millions of New Jerseyans who are suffering from the same disease that you are combating every day. We love you, and we're counting on you. Thank you, Vanessa.